So you've got to have honesty and you've got to be genuine. Then coming out of that will be trust. Don't have hidden agendas. I think that's really bad because it causes a bit of insecurities. And the person might think that, hey, there's another game here, that I don't know about. And that's why I think even if there's anything that disturbs you about the way the relationship is going, it's like being in a marriage. Talk about it, bring it out.
The key elements of a successful partnership are three. One is trust upon the two parties' consent. But the second one is what you can call joint planning, so that you can agree on the kind of actions you need to take. But the third one is commitment, where both of you are committed to implement what you have planned. To me, those are the key elements.
Values, goals, and a strategic plan that leads to an outcome that everybody wants and it's agreed upon. A memorandum of understanding from the outset to establish the ground rules so that you can always go back to that if there's any issue. I love MOUs. I think that grounds the work from the beginning and leads to the outcomes that are required.
I think, to me, an ideal partnership is the one whom you sit together, agree upon the goals or goal of the project, and the one whom you discuss issues openly, or there is transparency, and the one who is ready to share his or her expertise, with a listening, lens, and also who is ready to change when there are good things from the other partner.
Oh gosh, I think if you're working with people that are more extrinsically motivated, so they're more interested in the goal for personal gain rather than the objective of a good outcome in a partnership, then you're going to run into problems. Egos, I think egos can be quite difficult as well, particularly if people aren't collaborators, and working with people that are not collaborators. And what I mean by that is, they're not sharing information, they're not team players, is never going to work.
The elements which will interfere with a successful partnership are several, but the number ones are resources. That means the two parties have to mobilize adequate resources to implement whatever they have planned to do. But the second one is the lack of commitment, as I pointed earlier, that you might have agreed to implement something, but one party might not be committed fully to implement what they have decided to implement. The third one is lack of a proper monitoring and evaluation framework for the partnership. You should, at a very early stage, establish a proper monitoring and evaluation framework to monitor whatever you have agreed to implement, but also address the shortcomings of such a partnership.
Well, sometimes people are asked to do things and they don't believe in it. There is no buy-in, right? So there isn't that commitment. Now, I know I haven't used that word commitment, but that's an important part of a partnership. So if you lack the buy-in, you lack the commitment, it's not going to work. And then there are people who always want to win. They always think they have to be better than the person that they are working with. And maybe sometimes there are people that need to show the world that they're good. at doing things. So sometimes there's that hidden agenda. Now that's not going to help any partnership because that doesn't build trust and goodwill, and it's not honest.
We provide that Aboriginal medical service with a doctor at 0.5, so which is at about $55,000. Now, in return for that, we get student placements, and we have research going on in that place as well. I suppose, did we leverage off the fact that we put a doctor in there to get what we needed? Well, that would be, I suppose, up for discussion, wouldn't it? So if you were to ask the Aboriginal Medical Service, they would say, well, we needed a doctor, and that far outweighed taking students and other people. So I suppose it's about not abusing the power when you've got it, and being a blue ribbon medical school in Australia with lots of money, we could very easily abuse partnerships. We have, like I mentioned, really strict guidelines around the type of collaboration and partnerships that we have. My favourite is reciprocity. So anything that we take, we have to give back. So back to the example of the doctor at 0.5 in return for student placements, I think that's a fair deal.
Canada is thousands of miles from Tanzania, but partnership requires consistent communication, effective communication. So you need to establish very effective communication channels. If it's through emails or through phones or face-to-face communications, so that you can see the kind of progress which you are making towards your partnerships. How do you jointly plan if you are, let's say, hundreds of kilometers away? So you have to plan for that so that you can probably meet either physically or virtually. So these are the kind of challenges which you can expect.
For example, till today we have problems with our students not being forward enough, because in Malaysia we were never brought up to be argumentative, to speak our minds, because that can be seen as rude. And we have untold problems now when the students come to all the partner schools, and they suffer most in the North American context, especially in US, where people are terribly verbal. Our students know the answer, but they don't say it. They always stay in the background, and it doesn't work in medicine. You have to be forward, you have to get involved. When we ask our students why they're not, they say, well, it's rude to always try to show off. We say, no, it's not showing off. You see, that's a cultural difference. To always speak your mind and to be so forward is seen sometimes to be inappropriate behavior. It's not good to be pushy, you see. So the point here is this is some of the cultural things that we still battle with.
As a researcher, it's important to have output, as in publications and bringing in funding and all those sorts of things which are very extrinsic and very much about the individual. My values are very much placed around making the research count and making the research be about the betterment of other people and not about the betterment of me. And the people that I'm working with or will be working with, and I already have some relationships established here, that's the common goal. So in 5 years' time, better outcomes.
So unlike other partnerships where you are probably aiming at just achieving very trivial objectives, In health, the commitment is always towards the achievement of less morbidities and less mortalities. And this brings us now to the fact that when you want to establish a partnership, you should have very clear objectives which finally would target towards the reduction of morbidity and mortalities.
Educating the nurse educators on the HIV and the AIDS throughout the country, about 400 nurses. I think it was the first time because they were not taught about HIV and AIDS or ARVs, you know, and even support of people living with HIV. It was the first time that all the nurse educators who were at that time were involved, and also and then integrated the content into the nursing curriculum. So I think that is a big achievement.